Hey everyone, welcome back to the NPTE podcast. This is Will Crane, your host. Thank you so much for joining me as we go through the content you need in order to dominate on test day. And if no one has said thank you to you today, let me be the first to say thank you. Thank you for the efforts you put into this. I know that as you are studying, it's a difficult process. There's a lot that goes into it. Certainly you're spending a lot of time sacrificing time that could be spent elsewhere on this pursuit. But let me tell you, it's worth it. It's worth going through all this trouble, all the hassle of getting ready for this test. And let me tell you, it is definitely worth it being a PT on the other side. I continue to practice as a PT, and I just love it. I think it's so fun to be able to interact with patients. Sometimes the paperwork gets to be a little bit tedious, but I think every PT would tell you that. But it's so worth it. Thank you for doing it. And just a reminder, this is a great intersection of your skills and your interest. I talk to many students who tell me that this is their patients love them. They really enjoy the interaction with their patients, and that it's just a matter now of getting through the test. So the test is really, it doesn't define you, it just refines you. And so that's something I've been saying for almost 10 years now. But it's true that the test is really just an indicator of your academic aptitude. They're trying to see if you know the theory, the academic principles behind it, plus can you apply that to novel cases? And that's one of the other big things. You need to be able to apply this to cases where perhaps it may not be immediately apparent what the underlying condition is, or you have to use some clinical reasoning to make good decisions. And frankly speaking, on the test, they're really just trying to see if you can be a safe, direct, and effective PT. Safe, direct, and effective. So anytime you come to a question that you don't really know the answer to, ask yourself, what would a safe, direct, and effective PT do? Or another way to think of it, what would the most reasonable of reasonable PTs do in this situation? And if you look at it with that perspective, it makes it a lot easier, certainly less daunting to approach the test, especially with very difficult questions. So today I've got a question for you. We'll be going through a practice question, but before we do so, just a quick reminder to check out ptfinalexam.com. We've got constant courses going on. If you need a full course, we're starting up our VIP class. That's the one where it's extremely robust. It goes through all the content you need from, through every system, from cardiovascular, pulmonary, musculo, neuro, metabolic, endocrine, genitourinary, gastrointestinal. We go through it all, including the non-systems, plus practice questions. It's extremely robust. And if you need to pass the test, then this is the course for you. We also run a mid-level class. It's called the PT Premium class. And we've got this for PTs and PTAs. But our premium class is kind of a hybrid between our independent model, where we have all pre-recorded videos plus a few live videos. And then the last one that we have is the crash course. The crash course is really just meant to be 3 weeks of intense review of just the big three systems. So it is limited to the big three systems, and it's a lot of fun. And it's a great way to boost your score just a little bit as you head into test day. We're just finishing up our crash course. Actually, today's the last day of today and tomorrow, the last day of our crash courses as I'm recording this. But we run that 3 weeks before every test day. And I would encourage you to check that out and sign up. We also do have group discounts for all of those. So if you have a cohort and would like to get a group discount, please reach out to us over at ptfinalexam.com/contact. Plus, if you want all the freebies, the cheat sheets, all of the hints that we have for you, also be sure to sign up at ptfinalexam.com/podcast, where you can get on the list there and get all the great info we have. All right, so today we'll be talking through the metabolic and endocrine systems. So this system, certainly not a large system. It's one of the other systems, you could say, somewhere between 5 and 7 questions related to this. We'll be talking through differential diagnosis today, and I think I've got a good question for you. You'll like it. We'll go through it. As always, I'll read it to you, give you a moment to respond, and then we'll consider together what the answer is. Here you go. A patient in the intensive care unit, the ICU, has been recovering from a gastrointestinal infection and has been vomiting frequently for the past 3 days. While observing the patient, the therapist notes that the patient has a decreased respiratory rate. Which of the following conditions is most likely present? So 1, metabolic acidosis, 2, metabolic alkalosis, 3, respiratory acidosis, and 4, respiratory alkalosis. So again, we've got a patient in the ICU, been recovering from a GI infection, has been vomiting frequently for the past 3 days. It sounds miserable. While observing the patient, the therapist notes that the patient has a decreased respiratory rate. Which of the following conditions is most likely present? We've got 1, metabolic acidosis, 2, metabolic alkalosis, 3, respiratory acidosis, and 4, respiratory alkalosis. So as you consider this question, you're probably thinking to yourself, all right, it really is a mix and match type question. It's either metabolic or respiratory, acidosis or alkalosis. Now, in this case, we have a very clear understanding of what the cause is. They've been in the ICU for a gastrointestinal infection, and they've been vomiting frequently for the past 3 days. So we have a frequent and severe case of vomiting. What will that result in? So as you consider that if you are vomiting, you're vomiting up, not ideally, but you are vomiting up the contents of your stomach, which include all of the acidic, all of the hydrochloric acid that is in your stomach and gastrointestinal system. So your body is losing lots of the acid ions. And so therefore, when you lose a lot of acid, you become very alkaline, meaning that the pH has increased or has become basic. So this is a case of metabolic cause. It's caused by, not by the respiratory system. This is caused by the rest of the body, so to speak. Not the respiratory system, the metabolic system that has lost a lot of the acid ions. And because you've lost the acid, you've gone into an alkaline state. And so to compensate for that alkaline state, the patient now has a decreased respiratory rate. So maybe the thing that mixes people up the most is when considering whether it's metabolic or respiratory is you have to consider what the underlying cause is. So the correct answer here is metabolic alkalosis, meaning that from the large volume of emesis that has occurred over the past 3 days, the patient has likely lost a lot of their acid ions, and so therefore they have to retain acid. What's the easiest way to retain acid? Well, the easiest way is to hold on to carbon dioxide, which is the precursor to carbonic acid in the bloodstream. And so in order to compensate for the alkaline environment, your body is reducing respiratory rate to hold on to carbon dioxide. This is a classic case of metabolic alkalosis. Let's consider a case of metabolic acidosis. So not related to this question directly, but metabolic acidosis is when you have an increase in acid ions. This is typically when you have, the classic example is diabetic ketoacidosis or any type of lactic acidosis. So again, the most classic one is diabetic ketoacidosis, where a person has lots of ketone bodies. So ketone bodies related to diabetes, when they don't have enough insulin, their body can't find enough. It's almost like with diabetic ketoacidosis, your body is drowning in sugar or glucose, blood glucose, but it can't use any of it. And so it starts to try to create glucose from other sources. And the only way to do that is to pull apart triglycerides, which creates ketone bodies, which are acidic in nature. And so diabetic ketoacidosis is a classic example of metabolic acidosis. So as you consider what the compensatory mechanism would be for metabolic acidosis, well, if you have too much acid in your system, the easiest way to get rid of it is to begin to hyperventilate. And so that's often what you see with diabetic ketoacidosis is they have a high blood glucose and a rapid shallow breathing as they're trying to offload as much carbon dioxide as they can in order to reduce the acidity, or in terms of the pH scale. So pH, which is the measure of acidity or basicity, the lower the number, the more acidic it is. And so don't be confused on test day when it says, what do you want to do to the pH if it's too acidic? Well, you want to raise the pH if it's too acidic, because that means it's too low. Then talking about the respiratory system, now we have to totally change gears in our mind. The respiratory system, this is caused by a reduction or an increase in respiratory rate. So a good example of this is respiratory acidosis. Respiratory acidosis is when you have something that is effectively causing you to stop breathing. For instance, Guillain-Barré syndrome, or any type of disorder that causes reduced respiratory rate. So Guillain-Barré syndrome, where you have weakness of the diaphragm, spinal cord injury would be the same thing. Drug use, so opioids, or any type of depressant medication will reduce respiratory rate. And you guessed it, when you reduce respiratory rate, you're holding on to acid ions, holding on to the carbon dioxide. And so because it's respiratory in cause, that's what's called respiratory acidosis. And then finally, the last one is respiratory alkalosis. This is typically caused by an increased respiratory rate, usually related to anxiety or pain. This is also the one that usually occurs when you're trying to start a campfire. and you're trying to nurture the flame. You're blowing and blowing and blowing on the flame, trying to get it to go. And that's caused by hyperventilation. And as you would imagine, as you hyperventilate, you're offloading carbon dioxide. And so you're creating an alkaline environment. So therefore, respiratory alkalosis. So back to this case specifically, the patient has been vomiting frequently, and that's the cause. And the result then is a decreased respiratory rate. What's going on? Well, that is pretty clearly metabolic alkalosis, again, caused by severe vomiting, diuretics, ingestion of large quantities of base substances. All these things can reduce the acidity of the system. And so therefore, to compensate, you reduce your respiratory rate, try to hold on to acid as best you can. So you've gotten rid of the acid and you're trying to hold on to it via the respiratory system as best you can to compensate. So as always, be sure to check out our YouTube channel where we've got the video posted of these questions if you like to follow along video-wise. But we'll bring it to a conclusion for today. Be sure to check out all of our other questions and material. In fact, I do have a video on metabolic and respiratory acidosis, alkalosis over on our YouTube channel, so be sure to check that out. Just search PT Final Exam over on YouTube. You should be able to find us quite easily. Also, be sure to leave us a review over on Google Play or iTunes, wherever you're listening to this podcast. It really helps as we're trying to get the word out. And in the meantime, keep a grin on your chin. Happy studying. Will Crane fist pumps all around. I'll catch you in the next one. Thanks.